Hi, my name is Gabrielle D'Andrea. The ethical question my group chose to research was, should physician-assisted suicide be legal or criminalized? In this video, I will provide why I think it should be legal based off the research I've done on this topic. But there are many challenges in answering this question because it is a very controversial topic among physicians, and there are pros and cons that need to be considered on both sides. This act occurs when a physician facilitates a patient's death by providing the necessary means and/or information to a patient to enable them to perform this life-ending act, such as providing sleeping pills and information about the legal dosage while aware that the patient may use this information to commit suicide. But I do believe this right should be legal. It would allow a terminally ill man or woman to die with dignity and relieve themselves from their insufferable pain. And based off my research, I was saddened to be informed that if this act is not made legal, a terminally ill man or woman may commit suicide in a harmful or dangerous way. Making this right legal would also put a halt to financial burdens and worries of families that are going through this process of losing a loved one, which is a very important factor to consider. Thank you.
Hi, my name is Madeline McAfee, and I'm going to be talking about the reasons physician-assisted suicide should be criminalized based on the duties of physicians and why legalizing this practice would compromise their ability to properly do their job. Healthcare workers take a Hippocratic oath that states, "I will keep the sick from harm and injustice. I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." This oath outlines specific duties that healthcare workers must follow to provide proper care worldwide to all patients. Physician-assisted suicide is a clear violation of this oath and endangers the practice of medicine, since permitting killing would now be considered a form of healing. It is a cheap and easy fix that threatens the effectiveness of medical practice and should not be used as a way to treat a patient, no matter the diagnosis. If physician-assisted suicide were legalized, it would create a medical environment that promotes simple solutions over proper care and can lead to a corruption of medical care in all aspects.
Hi, my name is Serena Rakia, and I'm arguing why physician-assisted suicide should be legal based off of my research. How we die, live, and are cared for at the end of our life is important, with implications for individuals, their families, and society. These are the people who are most affected by our ethical question, plus the physician assistants. Physician-assisted suicide allows individuals to voluntarily request and receive prescription medication to quicken their inevitable death. If this isn't legal, the patient's autonomy are taken away from them, and also the physician assistants are not providing to the best of their ability their help to aid individuals, which is going against what their job profession entails. These are the reasons why I believe physician-assisted suicide should be legal.
I'm Michelle, and I'm going to be taking the side of why physician-assisted suicide should be criminalized. If it were to be legalized, it wouldn't just be available for people who are terminally ill, but for everyone that wants it, and even with the law stating that it would only be available for terminally ill patients, they will find a way around it. If it were available, then older adults who aren't terminally ill but feel that they are a burden to their family or don't feel like they can do what they normally would try to get euthanasia. Some terminally ill patients are being taken care of by their family members who would then have the ability to make the terminally ill patient's decisions. When the caregiver or medical proxy makes the decision to use physician-assisted suicide, it could be seen as irrational because the terminally ill patient isn't specifically saying it themselves. When the terminally ill patient isn't saying it themselves, it could be seen as illegal because they might not actually want to die, but because the medical proxy stated so, the physician has to legally follow what they requested. If it were to be legalized, who's to say that they are actually making the decision for themselves or having other people make it for them? The clinical implications, if it were to be criminalized, is that some people who are terminally ill might not die as peacefully as they want to, and many doctors who are providing euthanasia will then be arrested for providing it.
Hi, my name is Ashley Gugliotti, and I will be discussing why I believe that physician-assisted suicide should be legal. According to my research in the American Medical Association Journal of Ethics, there is a difference between professional law and professional ethics. In other words, even though a physician may be allowed to do something, that does not mean they have to do it if it is not the ethical choice to make at the moment. Legalizing physician-assisted suicide gives physicians the opportunity to use their professional judgment as to whether or not they believe their patient and his or her illness is an appropriate case for administering drugs that will end the patient's life. This means that they wouldn't always have to refuse aid to the patients who wish to end their suffering. If this practice is illegal, it would leave the physicians no choice but to not conduct physician-assisted suicide without severe and life-changing consequences. I believe it should be up to the professional's judgment to decide if this procedure would be appropriate, and therefore it should be legal. As you can see, the question as to whether or not physician-assisted suicide should be legal or criminalized is highly debated. There are pros and cons to both sides, which is why the law varies from state to state. Thank you for listening to our takes on this ethical question.